Jeremiah Bowers. Scanning the room. Hi, I'm Maya. I'm going to be your nurse practitioner for today. How are you doing?
Fine.
Good. Is it all right if I do a cardiac and peripheral venous exam on you today?
Yes, ma'am.
Okay, sounds good. So I already have you laying down. First thing I'm going to do is just inspect your jugular vein and your carotids bilaterally, because I'm looking for any pulsations or any jugular vein distension. So I'm just going to look with my light here. Maybe look my way a little bit. Okay, I am not seeing any visible jugular vein distension, and both carotid pulsations appear to be normal, so that is good. The next thing I'm going to do is use my light again and inspect this spot on your chest is called a point of maximal impulse. It's right here. Okay, perfect. And I am not seeing any abnormal pulsations there as well. Next, I'm going to just palpate your carotid pulses just one at a time here. Okay. Perfect. Both of those pulses are strong, regular, and equal bilaterally. I'm not feeling any thrills there either. The next thing I'm going to do is palpate the angle of Lewis, which is where your manubrium connects to your sternal body here. I'm just going to first feel kind of right here, and then I'm going to walk my fingers down a little bit. Okay, that is right there. And then I'm going to use my fingers again and palpate the aortic area, which is the second intercostal space on the right side of your chest. So again, I'm just going to kind of walk my fingers down, feeling your ribs to find the right location here. Okay, and I'm just going to feel for a second. I'm not feeling any thrills there either. The pulsation is normal. I'm going to walk my fingers over and do the pulmonic area here, which is just the second intercostal space on the left side of your chest here. And I'm going to feel. Again, that's normal. I'm not feeling any thrills or the pulsation's normal there. Next, I'm going to walk down to the tricuspid area. Okay. And again, I'm not feeling any thrills, and the pulsations are normal there as well. Then I'm going to walk my fingers down to the mitral area, which is also similar to that point of maximal impulse there. Okay, that is feeling normal as well. I'm just feeling a little gentle tap there as well. Next, I'm going to use my stethoscope and listen to your carotids bilaterally. I'm going to use the bell of my stethoscope, listening for any bruits. I'll have you hold your breath. Okay, you can breathe normal. And I'll give you a second, we'll do the other side. I hope you hold your breath as well. Okay, go ahead and breathe normal. I did not hear any breweries there, so that is good. Next, I'm just going to use my stethoscope and listen in those various places that I had previously felt on your chest. I'm going to use both sides. Your aortic, pulmonic, tricuspid, and your mitral areas are, the rate and rhythm are regular. I'm not hearing any murmurs, rubs, or extra heart sounds with either side of my stethoscope. And then I am going to just have you kind of turn onto your left side here, and I'm going to listen with my stethoscope in that mitral area right down here. First. Okay, at that point of maximal impulse, I'm not hearing any S3, S4, or murmurs heard. Now I'm going to have you sit up, and I'm just going to have you lean forward, and then when I place my stethoscope, I'm just going to have you take an exhale, and I'm listening at that same spot we just did. I'm using my diaphragm this time. Exhale. Okay, great. I am not hearing any murmurs there either. The next part of my exam, I'm just going to first inspect your arms here. So I'm just going to look at both of them here. Your fingers. Looking at this one. And your fingers there. Your skin color is pink, as well as your nail beds. It's even bilaterally. I'm not seeing any swelling or any prominent veins there. We're going to do that same thing, but I'm just going to look at your legs this time. So I'll have you lift up your drape here. Just looking. Put the back of your legs here. Back of your legs here. Okay. I'm seeing that your skin tone is pink and even bilaterally. Your nail beds are pink as well. And I do note some varicose veins, various locations, and then that scar on your left knee right there. I don't see any rashes or ulcers. And it looks like your skin is dry and you have even hair distribution throughout. Okay, you can cover back up with your drape there. The next thing I'm going to do is palpate various spots on your arms. First, I'm going to do your radial pulses here. Okay, those are 2 plus and equal bilaterally. Now I'm moving to your brachial pulses here. Again, 2+ and equal bilaterally. Now I'm going to feel your epitrochlear nodes, which is just about 3 centimeters here above your elbow. Okay, I'm not feeling any nodes there, so that's good. And then I'm going to feel your fingers, check your cap refill here. Your thumbs. Okay, great, less than 2 seconds bilaterally. Now we're going to do your legs, and I'm going to again feel your pulses here. First, I'm going to start with your dorsal pedis. Perfect. Now moving to your posterior tibial pulses. Your popliteal pulses. And then your femoral pulses. I'm going to feel right down here by your groin. Okay, all those pulses are 2+ and equal bilaterally. Now I'm going to feel the lymph nodes by your groin here. I'm not feeling any swollen or enlarged nodes there. Was there any tenderness with that?
No.
Okay. Now I'm going to do the cap refill on your feet. Okay, that is less than 2 seconds bilaterally. Now I'm going to have you move your drape up a little bit again, and I'm going to feel the warmthness of your legs with the back of my hands. All right. It seems to be equal bilaterally, except for on this left knee here is a bit warmer than the other knee. Then I'm going to press in some various locations and check for edema. First checking your feet here. Okay. Okay. All right, I am noting no pitting edema bilaterally. The next thing I want to do is called the Allen test. So I'm going to use my fingers and kind of occlude both your radial and your ulnar arteries and veins there. And I'm going to have you pump your fist several times until I say stop. Okay, now go ahead and leave it open. And I'm releasing just one side here, the radial side, and it has returned to pink. I'm going to have you do that same thing, and then we'll do the ulnar side there. Okay, go ahead and leave it open. Okay, perfect. Both of those turned pink in just a few seconds, so that means there's good ulnar and radial patency there. I'm going to do it on your other hand as well. Okay, pump your fist. Okay, go ahead and stop. Releasing your radial side here. Perfect. Okay, pump again. All right, go ahead and stop. Releasing your ulnar side. Okay, great. Those also returned to pink in just a few seconds, so that is normal as well. The next test here, I will have you lay back, and then I'm going to raise your legs up to 60 degrees, and then I'm only going to hold them for about 10-15 seconds. Actually, I'm going to hold it for about a minute, and then after the minute, you'll turn and dangle your legs off the bed, and then we'll see if they return to pink. So we'll lift your legs up to 60 degrees here for you.
Probably.
Okay, go ahead and swing your legs over and dangle them down. Okay, perfect. I'm seeing that the pinkness has returned to your feet, and I'm seeing normal arterial flow. That concludes our exam today. Thank you.